My name is Miss Cindy Renteria, and we're going to be starting off with our infant video of the week. Thank you for joining me. Thank you for coming along with us in these activities that we have for our little ones, which are, as we go by, our babies are growing. Maybe you started off with the 0 to 3 activities. Now you're moving on to 3 to 6, and it's exciting to see the growth in your little one. So we're going to go ahead and start off with our greeting song. From our greeting song, I will do a book, and then we'll move on to the activities. Once again, thank you so much for joining me here again. And this is the infants video for this week. Thank you. Miss Cindy's here today. Miss Cindy's here today. Clap, clap, clap. Miss Cindy's here today. So remember, Mommy, of course, some of our little ones are not able to sing, or they're not making any babble sounds yet. So we're the ones that go ahead and sing the song for them. And we have the 6 to 9 months, 9 to 12, they're already clapping. They can clap along with you. Or they can, just by them seeing you sing and smile, that's enough for them to start building the social emotional skills that we want. So remember, moms and dads, it's important to sing to our little ones. It's important to be smiling to them all the time. And we're going to be discussing about that in just a little bit. So we're going to go ahead and start with our book. I have a book here, Leo Loves Baby Time. And this is the book I have here. Miss Cindy has to improvise today. I didn't have a book. Leo loves Wednesdays. He eats his breakfast. He puts it on his jacket. He sits in the stroller, then off he goes to baby time. Everyone says hello. Everybody's saying hello to the baby. First they sing the happy song, then they play peekaboo with scarves. They sing a happy song like we do, now they're playing. They sing the stretchy song and the rolly song. Next they play with their animals. That is Leo's favorite. They wiggle their fingers and clap their hands. They wave their arms and they kick their legs. Oh, these babies are having a lot of fun. They ride the bus and their horses, of course. Then they zoom onto the moon. Last, there's time for a cuddle, a story, and making new friends. That would be the end of our book. I hope you guys enjoyed it as well as I did. It was a short book. And remember, moms and dads, our books that we read to our little ones, they don't have to be so long. And remember, they are infants right now. If our toddler has a little of a hard time staying to listen to a story for so many minutes, and I mean minutes, 5 minutes, 10 minutes is a long time for a little one to stay still. So remember, but we still want our babies to hear our language. This is when they start developing language skills. Their brain are connecting. They hear our voices. That's mommy's voice or that's daddy's voice. They start recognizing, just start seeing that maybe when dad comes in from work and he's facing you, he hears dad, you see him smiling already. That's when they start recognizing. So it's also important for dad to read to our little one. It's not always mommy reading time. It's also daddy reading time. It's important for our little ones to hear our different voices, not just moms or not just dads. So we're going to move on to the activity for this week. It's going to be for 0 to 3 months. It's going to be face to face. In this activity, you'll be holding your baby. Of course, so tiny at this age. Holding your baby, you want to be as close as I'm here like this to your little one, so you can have that face to face. Remember, a smile is contagious to us. Imagine what a smile can do for our little one. We want to always be talking to our little one. We want to be able to be visible for them. We want to spend that time of face to face. Sometimes we may hold our little one and, we're busy talking to our significant other, or we're telling the kids to stop moving, and we don't do that face-to-face time with our little one. We're holding them and we're feeding them and we're trying to do other things. Or if he's laying there and you see, oh, he's calm, we start scrolling on phone. The baby needs that face-to-face time with you, even if it's a couple of minutes throughout the day. And it's very important for us to always be smiling, singing to them, talking to them. You're changing their diaper. That's a perfect time to do your face-to-face. You know, those couple of minutes that you're doing that, or when you're after you bathe them, or when you're bathing them, that's another opportunity to do the face-to-face time. Remember, moms and dads, it's very important for us, for our little ones, to be able to have that social emotional with us, and their development then by them being able to listen to us and to see us smile and to see us sing. And what we have for 3 to 6 months is going to be the activity mirror, mirror. We all have a mirror at home, and maybe you may have those mirrors that are more like towards the floor, and what you can do is sit on the floor and sit your baby in front of you, and both of you be looking at the mirror when you're talking to each other. So this activity is going to be done with you and your little one. So this is mirror, mirror. So you're going to be facing both of you, or if you don't have a mirror where you can sit on the floor, you can always go to the restroom or your vanity or anything. Hold your baby, and both of you look at the mirror at the same time, and you can talk to your little one through the mirror, and you're going to see his expressions by him seeing himself and seeing you. Maybe he'll get excited seeing himself. I've seen that a lot. When babies see themselves in the mirror, they think it's another baby, not them. So that's that's the extra of doing this activity with your little one. So remember, mirror to mirror. If you're holding your baby, you want both to be facing the mirror when you're talking to your baby. And you want to give them that smile, or even holding them while you're singing a song, just that constant communication. So we're going to move on to our activity from 6 to 12 months. You're going to be doing this, what it is, a spider. It's a spider, and you're going to be getting a plane, and you're going to be doing the 3 little legs with a piece of paper. You can be doing the 3 little legs of the spider and just putting some little eyes here. And you're going to be making the spider for your little one. And this activity is for 6 to 12, for the ones that they're already starting to sit, or the ones that are propping. We're going to do this activity with them. What you're going to do, you're going to have your spider, but you're going to be adding the song to this. You're going to be adding the Itsy Bitsy Spider. The Itsy Bitsy Spider went up the water spout. Down came the rain and washed the spider out. Out came the sun and the Itsy Bitsy. This is what you're going to be singing to your little one. You're going to be singing the Itsy Bitsy Spider song using your spider plate. And if you don't have the plate, or something happened, or the older one grabbed it, you go ahead and just sing using your hands. The Itsy Bitsy Spider went up the water spout. Down came the rain and washed the spider out. Out came the sun and dried up all the rain, and the Itsy Bitsy Spider went up the spout again. We can always use our hands and movements, and of course we want to be smiling as much as we can during this activity with our babies. Especially at this age group, they need constant visual. They need to be seeing our faces a lot. They need to feel our warmth. They need to feel comfort. So this is the perfect timing when you can spend this quality time with your little one. And then also what was included in this packet for this week is tips for families. Like I say, talking is teaching. Remember, we may know already how to identify our eyes, our noses, our mouth, our fingers, but our little ones don't. So this is when it's talking is teaching. When you're changing them, or when you're bathing them, you can tell them, oh, I'm washing your head now. We're going to wash your head. Mommy is scrubbing your head. Mommy is washing your arms, your fingers, your small little toes. Teaching is talking. Talking is teaching, So this is what we want. We want to constantly be talking to our little ones. You'll be very impressed you may start saying words so often, like mommy, or start singing songs, and you're going to start noticing that they're going to be connecting, oh, the Itsy Bitsy Spider song. They're going to know already, oh, this is mommy's going to sing to me. And all their emotions and feelings are going to start, they're going to start getting happy. They start, or you may say, mommy's washing your toes. And since they already know, mommy washes my head, my arms, and mommy washes my toes, you're going to see they might pick up the toes before you even reach for them. And remember, we want to constantly keep talking to our little ones. We want to be happy at all times. We want to smile. We want to sing to them. We want to read to them. We want to make story time a happy time. We want to make story time just quality time with our little ones. It's important for them to feel that those couple of minutes where it's mommy and me, giving them their attention, and you're smiling, and you guys both having a good time. And then also when it comes to the Development Center Parenting Handout, you receive your baby's teeth handout. And in this handout is, you can't see them yet, but your baby has teeth. They formed before he was actually born. They will start to appear when he is between 4 to 10 months old. So if your baby is 4 months, you are already going to start seeing, you know, or sometimes you may start seeing the little white lines, you know, or they see that they're like biting in their hands, or they're biting a toy really hard, they're rubbing it, you know, where their bottle, they're using their bottle as a soothing. It's because their teeth are coming along. And then this is what you guys can do to help your baby's teeth. You can start caring for your baby's teeth now by taking care of the gums. Gently wipe your baby's gum with a damp cloth. You always have a damp cloth. And remember, we're going to use a certain damp cloth. We want to use it just for that. A damp cloth or a gauze pad after each feeding. So what you want to do is you're going to want to wet the damp and put it in your finger, and you want to wipe their gums after every time they eat. This helps their little one get used to having his mouth clean, and will make toothbrushing easier once the teeth come in. Keep doing this until the teeth come in, then start using a baby-sized toothbrush. Of course, when your baby already has those little teeth coming in, you know, you want to start using a baby toothbrush. You know, they are more gentle, more soft, but as that, we want to be using the gauze. And this will prepare our little ones for when their actual teeth come out. If you give your baby a pacifier, make sure it's clean. Before giving it to her or him, rinse it with water. Do not dip it in any sweet liquid sugar. We don't want to do that. Do not clean your baby's pacifier by putting it in your own mouth. I've seen that before. Don't do that. You know, sometimes I've seen moms where they pick up and they just put it in their mouth, and then they give it to the little one thinking that it's clean. Don't put it in your mouth, and don't test bottles or foods with your own tongue. The bacteria from your mouth will be transferred to your baby and will start to grow in your baby's mouth. And take good care of your own gums and teeth, and you will not, you know, and you won't be passing along germs to our little one. Dental care. You know, remember, babies, as soon as they're 6 months, they're due for their first dental checkup. And, you know, you know, sometimes they may tell you 1 year old, and some dentists will see the baby at 6 months. You know, make sure you keep up with it, and you take your little one to the dentist and make it accustomed to them, so they won't be scared of going to the dentist. They'll know, oh, every 6 months I go see the dentist. And then also, of course, you know, there's dentists that specialize with children, and you may always call your insurance provider or even ask us, and we can help you find a dentist that focuses on children. Which sometimes when we have dentistry that are pediatrician, their environment in the dental place is more pleasing for a little one than other than just walking into bare white walls. So I've seen dental places where they have a really nice decorating, very soothing. Their music as kids, you know, it makes it more of a calmer time when our little ones go. And then also, and they'll be catching activities as early as best. You know, that's what we want to keep that constant routine checkup at the dentist. And then also preventing cavities. It is easy to prevent cavities. You know, we want to use, of course, we give our little ones sweets. We're going to give them a cookie here and there, or a cake, or, you know, even fruits are sugary. You know, so we just want to minimize the intake of sugar. We don't want to be giving our little ones Coke or like Kool-Aid or anything that has a lot of sugar. We want to minimize that intake. Or, you know, add a little bit more water to it before we give it to our infant. And then also, oh, 1 second, the screen got a little bit too big. And, you know, when it comes to 4 and 6 months, you know, this is the baby's mouth. When it's 4 to 10 months, you'll see the 2 little small teeth here. When we're moving on to 7 and 12 months, you start seeing 4 little teeth and then the 2 here. When we're moving along to 13 to 18 months, you start seeing their 4 little teeth and some molars coming in. When the molars come in is when it gets a little tough. I remember with my daughter. And behind the handout, it's going to give you an explanation of the teeth that I'm showing you, and it's going to break it down a little bit more for you. And then also, one little teaching time information that I want to give to you is before his teeth come in, your baby may draw and be fuzzy. Teething does not cause fever or diarrhea, but your baby will feel more comfortable if he chews or on things that can be, you know, a little bit colder. Sometimes the cold can soothe them, or sometimes we can give them a toy that is going to soothe them for this time. And then to help your baby feel better, gently rub his gums, with, of course, with a clean hand. You can also put a wet washcloth, you know, just to keep them that soothing. And sometimes there's over-the-counter pain medication that can help, you know, but you can always ask your baby's doctor before you go ahead and move on to this step. And remember, moms and dads, if you guys have any questions, any concerns for any of the information I gave you, you can always ask myself, Miss Cindy Renteria, or you can ask your home visitor. And we are more than happy to help you and to continue to give you the information that we can to provide you to provide you with the resources that you need. And once again, my name is Miss Cindy Renteria, and thank you so much for being here. This is our infant